My name is Stacy Croden, and originally I was the founder of Turn the Corner Foundation, and in 2011 we merged and became the Tick-Borne Disease Alliance. When we were Turn the Corner Foundation, one of the first things when I started the foundation, I said we must start a foundation because we do not have enough physicians. We don't have enough doctors to treat people. So the first step in my mind was, let's come up with a physician training program where doctors all around the country can come and study with Lyme literate doctors and then go back to their hometowns and treat. That's how the program began, and that was the original idea of how to create more Lyme literate physicians. So the program has really been remarkable. It started out and there were only a couple of doctors doing the training, but as time went on, there were many more doctors who participated. What was so amazing is out of this program, we've been able to create doctors' practices that are solely dedicated to tick-borne diseases. For instance, Dr. Ann Corson went through our program, and now she's one of the family practitioners / pediatric people in the world. So there's been some amazing trainees that have come out of our program and have really taken it to the next level and dedicated their practice, so to speak, to treating tick-borne diseases. So it's really been amazing. We've also had doctors come internationally and study domestically with us and then go back abroad and treat. And what we all know is the strains of the bacteria abroad and domestically are so different that for these doctors to come and study here and learn from our physicians what's going on in the United States is so helpful for them to take this knowledge back abroad, because they see people who travel all over and they see a variety of different strains there. So it's really been a remarkable program. The program has been really, really pivotal for pediatricians as well, because in addition to Ann Corson, we've been very, very lucky to have Dr. Charles Ray Jones and to have some pediatricians study with him. But one thing that we're focusing on in 2013 with the program is getting more pediatricians involved. The more pediatricians we train, the better. So that's one goal of 2013 and moving forward. We're also trying to encourage the doctors that do get involved to also become part of ILADS. That's also a goal. The problem is in medical school, these physicians or budding physicians just learn a 5-minute, couple of pages, 15-minute lecture about Lyme disease. Often they don't even learn about tick-borne diseases. So it's a real problem. Here they are entering the world, becoming doctors, and they're faced with patients who not only just have Lyme disease, they have a multitude of tick-borne illnesses, viruses, bacteria. So this isn't just typical Lyme, bullseye rash, let me treat it, move on. There is a huge population, I would say the majority of physicians worldwide, they learned what they learned in medical school. The patient comes in and they are totally unarmed to diagnose, totally unarmed to treat. So our whole idea with the training was educate the physician about what to look for, what clinical symptoms to look for, how not to always rely on the test, because as we've learned, the tests are not conclusive. The tests that are currently available are not accurate. The diagnostic tools available are totally not accurate. So a lot of the times it takes a clinician's perspective to look at the patient and say, wait a second, you might have a negative test, but what's going on here? What's really wrong with this patient? And unfortunately, unless they've seen 10, 20, 30, 40, 1,000 cases, they're just not prepared. They didn't learn it in school. So what this program was designed to do is to have the trainee come to the office of the current tick-borne disease literate physician, follow them around, do a total hands-on experience where the expert doctor can show them from step one, from A to Z, education, awareness, diagnosis, what to look for, what happens if your patient does not have a bullseye rash, which you learned in medical school. They have all these strange symptoms, how to really hone in on what could be going on. The key to this illness is early treatment. So what we're really trying to do is get these doctors all over the country to at least become educated enough to do early awareness and early treatment. If you treat it early, you don't get people, children, adults coming in 5 months later with every symptom under the sun. If you treat it early, when it's in the beginning stages, a couple of weeks usually of antibiotics, and the person will be okay. But once it gets more chronic, it's just a disaster. We're trying to arm all these physicians internationally, domestically, to recognize symptoms, recognize how to do treatment, and get them thinking of tick-borne diseases. When somebody comes to an ear, nose, and throat doctor, or a gastroenterologist, or a gynecologist, or whatever their symptom may be, we're trying to get these doctors also in these specialties to say, wait a second, let me think about Lyme, let me think about tick-borne diseases, because too often they don't. And we wind up with very ill people in chronic stages years later. If we can arm these physicians with the knowledge to think tick-borne diseases, we're getting somewhere. That's our real goal. And so far the program's been great. We've had hundreds of doctors go through the program, and a lot of them, as I mentioned, have really dedicated their practice to tick-borne diseases. If we could have more doctors do that, that would be great, but that's our ultimate goal, to have doctors dedicate at least part or a portion of their practice to treating. And it works. It's grassroots and it works, because we get calls all the time. I live in Alabama. I'm sick. Where do I go? And unfortunately, we might not have any doctors in Alabama or whatever the state is. But if we can really continue the training and train these doctors from all these different parts of the country and world, we can have doctors that these people can go to. Right now, we might have to say, okay, you have to fly 4 states to whatever the state may be to find a physician who's not only willing to treat, who might take your insurance, and who knows what they're talking about. So it becomes really, really challenging without physicians. Well, here at Tick-Borne Disease Alliance, what we really like to do is help the patient. Help the patient. Hope is on the way. These patients can come to our website and help find doctors, but they can also rest assured that with this amazing program, there will be more doctors. There will be more doctors in their friends and their neighbors and their cousins and all these communities that they can go as a place for help, a place to get diagnosed, a place to start treatment, a place to refer their friends. So there is help, and at Tick-Borne Disease Alliance, we really stress this program, and we really try and get our donors and our people who are involved with the foundation involved in the program and to support the program, because as we said before, this disease isn't going away. It's easy to catch, it's hard to diagnose, and one of the ways to help is getting more physicians. It's a key element of this crazy puzzle we're in. Currently, our Tick-Borne Disease Alliance Physician Training Program is a week. So doctors would study with the training doctor for 1 week, and then they would go back to their hometown. What we'd like to do is even expand the program for a longer period of time where doctors could get more time training, or if they can't take that much time off from their own practice, they could study a week and then reapply and come back another week at a different time. Because often what will happen is they'll take that knowledge, they'll go back to their practice, and after a couple of months they'll say, wait a second, I have a list of 20 questions, or I have a lot more information I want to dissect before I see my next patient. So then they're able to come back for a second week. And what this will do, this is not going to make them an automatic expert in the area, but it sort of will, it's sort of getting their foot wet. It's getting their foot wet into opening up, oh my goodness, there's a lot to learn about this disease. I'm just scratching the surface. But scratching the surface and creating interest with any fields of medicine is what creates brilliant doctors. It's what gets doctors or researchers into finding out more about the problem and what's going on, because it's so complicated, this illness, that even the experts who are touted as the experts say it's so complicated, I don't even know. It's gotten so complicated with 10 different, 20 different, 30 different viruses mixed in with all the bacteria that what sort of even used to work is changing. So being able to study with the doctor on the forefront is just such a good way to open the door for some of these doctors who learned about it for 10 minutes in medical school, and yet they're seeing patients in and out of their doors every day. And some of the patients, I'm sure they're questioning when the patient leaves, saying, what was really wrong with this person? Did I order the right test? Is there a test for what's wrong with this person? So it's just an amazing vehicle to get these doctors thinking about other ideas such as tick-borne diseases, because it's so prevalent. It's not anymore that you have to be in the deep woods to get it. So every single state, I'm sure if you've interviewed doctors who've said every state, every continent, it's everywhere from birth to 100 years old. Nobody's immune. So if we don't have doctors to treat it, it's just a disaster. Hey, Dr. X, why don't you know about tick-borne diseases? Here's a program also you can train and learn about. So it's really grassroots, reaching out to these communities and getting a lot of these home doctors, small local doctors, don't even know. They don't even know what's out there. So this would be an extraordinary experience for them. A lot of these doctors come and study with Dr. Horowitz and Dr. Leader, and they are blown away we get letters after these doctors train, and they are totally incredulous about the experience they've just had and how unreal it is, and how, wow, I've been practicing medicine for 20 years, we'll get often, they'll say, and I had no idea about any of this. So we're really opening up their worlds and creating help for thousands and hundreds of thousands of people across the nation.